Good afternoon, everybody. Hello. Please take a seat if you're standing. This is going to be an hour of conversation. And I know your gluteus maximus would appreciate it if it had a seat. Very good. Welcome to VitalTalks live at UNGA. There are many VitalTalks at UNGA, but this is the only one that is called VitalTalks at UNGA. I can tell that you are very interested in health taxes just because of the number of people in the room. And I know why you're here, because in this current climate of difficulty financing development, financing health, you were lured by the prospect of free money. And I don't blame you. This conversation will be in two parts. Looking at the future of health of financing in Africa, which will be unpacked by three expert speakers, and then also sharing global expertise, which will be shared by you. We will share that conversation with you. So the second part of our hour will be with you, your experiences, and also your questions and insights as well. My name is Femi Oke. I am your moderator for the next 1 hour. It's my pleasure to be your moderator, and also to ask you if you indulged in some summer publication reading. Did you read this summer blockbuster, an on-demand in webinar, The Future of Health Financing in Africa, The Role of Health Taxes? Was that on your summer reading list? I thank you. One or two people, excellent summer reading list. I have the co-author of that publication, the host of that webinar, here with us today to explain why health taxes in Africa is going to be so critical, so important, and also give us some context as well. Dr. Adam Karpati, we love your work. You're one of the senior vice presidents at Vital Strategies. The lectern is yours. Good afternoon.
Hi, everyone. Good afternoon. Thanks very much for being here. Looking forward to this discussion. I'll just make a few framing introductory remarks. On behalf of Vital Strategies, we're a global public health organization. We work in partnership with governments, civil society, addressing NCDs, injuries, and other leading causes of death and illness, and have been working on health taxes for many, many years in collaboration with governments. Health taxes, and by that we mean excise taxes, in particular tobacco, alcohol, sweetened beverages, are among the most effective and cost-effective interventions for preventing NCDs. And they're endorsed and recommended as best buys by the World Health Organization, and are promoted by many international organizations around the world working with governments. There's a strong evidence that raising taxes on unhealthy commodities leads to raising increased prices, decreased consumption, and saved lives. The Task Force on Fiscal Policies for Health estimated that 50% price increase on those three commodities over the next 50 years would save 50 million lives. So the evidence, the impact, the potential impact is huge. Unfortunately, with some exceptions, health taxes are not robustly taken up around the world. And that's what we're going to be talking about today. There are some exceptions. I would point to countries in Africa, Mauritius, Cabo Verde, Botswana for alcohol, Ethiopia for tobacco. South Africa is has traditionally been very strong on tobacco. 2018, South Africa raised taxes on sugary sweetened beverages, the so-called health promotion levy. And just last year, the National Treasury in South Africa put out a report calling for increased taxation of alcohol. So South Africa is a place to watch. But many other countries aren't taking advantage of this intervention. Around the world, there's other great examples to learn from. Vietnam recently raised taxes. Brazil is in the midst of a historic and opportunity. Mexico and others. So we're very proud at Vital Strategies to work with many governments around the world, including many of those on health taxes. And we just to end, mention just a couple of resources. You just heard about the report we put out, the future of health financing in Africa, the role of health taxes. That's in the back. And that's just a general background on health taxes, the rationale, the burden of illness and premature death accounted for by unhealthy commodities, common industry arguments and rebuttals to those, country examples. And one thing we also wanted to do was really compile in one place information about all three products on the continent of Africa. And so we have the table of tax rates, and you can see that in most countries these rates are quite low. And then the other report I wanted to draw your attention to, this is the one on your seats, is something that we're releasing and launching today, Health Taxes, an Action Guide. And one of the observations working with governments is that often health taxes are seen as a ministry of finance or a finance intervention and not as much engagement from the health sector. And so this action guide for policymakers is really tailored to those in the health sector and others working in allyship and collaboration with ministries of finance on practical ways of supporting and advancing health taxes. The health role is really important. It's about articulating the health rationale. It's not just a financial rationale. It's a health rationale. Being that policy partner and ally with finance. It's about the epidemiology that the health sector can bring, the data that the health sector can bring on both the burden and the potential lives saved. It's about the communications, the strategic communications role of the health sector and government public health agencies in putting out information to the public, on making the case, on speaking to the population. And it's about the health sector's unique ability to rally and engage civil society, because it's ultimately the combination of government work and civil society work that leads to the advancement of this important policy. So with that framing, with that background, I'll turn it over to Femi for the panel. And thanks, really much looking forward to this exciting conversation. Thanks a lot.
Thank you, Adam. Our panelists today, Mary-Ann Etiebet, MD, President and CEO of Vital Strategies. Please come take a chair. Edwin Macharia is a co-founder and managing partner of Axum.Earth Alliance for health financing. And Serah Makka, Executive Director for Africa One. So I enjoyed, Adam, unpacking how easy it is to get revenue from health taxes. You just put taxes on tobacco and sugary drinks and also alcohol.
Alcohol.
It's UNGA week, I forgot about the alcohol. All right, and alcohol. But if it's so easy and it's such low-hanging fruit, why isn't every country in Africa doing it to the max? What's the issue? Discuss.
And I would actually broaden that, not just every country in Africa, but every country across the globe. It is the $3.7 trillion question that we have in front of us here. You're fully right. I think many of us think that this is, I like to call it a slam dunk. It's the three-pointer, the triple win. We have 50 million lives saved in 50 years. There's the revenue generation. I just talked about $3.7 trillion. That's most of that, it will be accrued in low and middle income income countries, and it would cover 40% of national health budgets. And then that third win is how do we actually reduce the burden on our health systems from non-communicable diseases, as well as fund their ability to take care of all of our needs in a holistic and comprehensive way. So yes, it is a $3.7 trillion question. I think what I would say is not why hasn't it been done, but why hasn't it been done yet? And I think the yet is all of you in front of us. It's the coalition. I think before now, we haven't been able to bring folks from all different aspects of the global health community or the public health community or the non-health community, the finance community, the agricultural community, trade community, because there hasn't been a burning platform. And I was just talking to Serah. I just met this woman in April, yeah? And I actually have to commend and thank her for bringing to our attention the fact that with the global financing crisis, we've all experienced it, the precipitous decline in funding for global health really had us asking the question, where are we going to be able to find the money to finance what are critical health needs? And not only that, we know that it's going to have to come from domestic sources. It's going to need to be sustainable. We're going to have solutions that can be scaled quickly because the gap is here, the gap is real. And, what solutions do we have at hand? Health taxes, have existed, I think, since the 18th century when, they first started taxing, I think it was tobacco, in the United States. So this tool has been around for centuries. And I think now is the moment to talk not just about the potential for it, to support our financing needs, and I say all of our financing needs, but also to bring attention to the public health benefit, because I think that has sometimes been lost, in the dialogue. All of you are probably aware that right now, the number one killer across the globe are non-communicable diseases: lung disease, heart disease, diabetes, cancer. 70%, more than 70% of premature and preventable deaths are from non-communicable diseases. Yet only 3% of global health financing goes for the prevention, control, care, or treatment, of these diseases. And while we may be getting away with it right now, we're not going to get away with it in 10 to 20 years. When our children who are now getting hooked on tobacco, on sugary beverages, UNICEF came out with a report last week about the obesity epidemic. When that generation becomes 40 or 50, what is our NCD crisis going to look like? I'll stop talking soon. Some of you may know I started my career in HIV, and I remember a moment in 1999 where it was decimating the continent. And at that time, people were saying that HIV didn't cause AIDS, yeah? And there was so much misinformation and disinformation and stigma about the disease. But we knew that if we did not deal with it, and if we did not focus on prevention, it would change the trajectory of a continent. I fully believe we are in that same consequential moment in time, that if as a continent we do not with the NCD crisis, we are looking at, not just the health, of our children not being able to live to their full potential, but the economic impact, of lost productivity, from the NCD crisis, the economic impact on national budgets and abilities for countries to continue to fund the critical things that they need to fund, that is going to be devastating for so many of our futures. And so I'm just really excited that all of you are here, because there are so many faces I do not recognize, which is great because it means that you are interested in something that you may not have been interested in before, and you're thinking about how it may also be a solution that we can work together to push to make happen at the country level. So thank you for coming to our event today.
So while Marianne was talking, Edwin was making notes. And we were just really curious to see what you're
You can't
writing.
even read them. They're such small handwriting, which I love, because only I get to interpret.
But I know that as Miriam was talking,
But that's the idea is public.
thoughts were happening.
Absolutely.
Share them.
So one thing I think that is important to remember is the NCD challenge that the continent is facing is in a lot of ways not something that many other countries will want to get to help solve externally, right? It was much easier when it's
An infectious disease, Ebola, or something that can cross
borders, and countries would be concerned from a health security perspective, and therefore they would rally and put in pandemic
preparedness and management.
or even HIV, AIDS, TB, malaria, which we know is going to grow because of climate change, and the various belts are beginning to shift. Increasingly, at least what I'm hearing in my conversations with a whole range of heads of state and folks who are controlling ODA type budgets, is if it comes back, which is still a major if, chances are it will not have a substantial ODA piece because it doesn't affect them as directly, right? Which increases the reasons why countries need to have even a deeper focus on how do they finance the NCD challenge. Now, anything like taxes, from where we sit, we spend a lot of time in public policy and saying how can you actually move the needle, right? We think that there are three critical things. There's a triangle of things you need to hit if it's going to be successful. The first one is, are you designing public policy that is technically correct, right? The things that you're designing, do they actually increase revenue collection, and do they reduce kind of use of tobacco, alcohol in the community, and long term reduce the NCD burden, right? That's something that we can do in this room and kind of figure out, okay, this is how much you need to increase the taxes by, this is what happens with the demand elasticity, right? You can model that stuff out. The two that usually get forgotten are frankly the reasons why our great papers do not translate into reality. One is this actually politically feasible in a particular country, right? We've seen tax morale, people's desire to pay taxes take a substantial plummet in most African countries because of what they perceive to be what governments are using those taxes for, right? Are they actually using them for our benefit? And if the answer is people feel
That's no, I will be dodgy as hell and underreporting how much tax I should pay.
So tax morale in most countries tend to be fairly low. So imposing new taxes becomes a politically difficult thing, right? You sit across, and I spend a fair bit of time doing this, you sit across heads of state, Minister of Finance, Minister of Health. Most of us go to them and say, you need to invest more in health. And they say, absolutely yes. But what we forget is, for them, it's a zero-sum game. To increase more in health, I need to reduce somewhere. Do I do less money to farmers and agriculture? Do I stop paying my soldiers and then there's a coup? What's the thing that I find money from to put into health, right? And if you don't get that right, it almost doesn't matter how good your advocacy is, because they will say yes, because their instinct is to say yes, but practically nothing will shift. So whatever solution you put forward, you must understand and think about the politics of that country, the tax model of that country, and just as importantly, you're not playing in an empty field, right? Industry is incredible. Industry will push back very, very hard. Industry will be underhanded in the way it pushes back on some of these additional taxes you're trying to bring to the table. So what's a coalition that gives backbone to your politicians to say, yes, industry, I know you create X number of jobs, you pay X number of payee and excise taxes and so on and so forth. We think this is better for our people in the long haul, and therefore we will make that point. And if you don't do that, it almost becomes a non-starter, right? Because otherwise you're having conversations and you can't get people to come on board. The second big one is administratively, how do you make it operational, right? So it's one thing to say increase taxes. Okay, so we'll go, you'll play the politics, you'll get the heads of state, you'll get parliament and others to say, yes, we want to increase taxes, and probably they increase the taxes. But how does that get collected? Is it ad valorem, and so what's the mechanism to identify how many cigarettes were sold in a particular ecosystem? What's the tax rate on top of it? Where does that money go? Is it going to the general budget, upon which it will fund education and sanitation, or is it ring-fenced for health? And in countries like my own country, Kenya, where health is a devolved function, that money ultimately needs to go to the equivalent of the states, right? Is it possible administratively to identify the taxes that need to be collected, classify them appropriately, actually collect the money, and put it in ring-fenced vehicles that then can go to health. And if you don't do those things, then what you'll end up is, again, you've spent a lot of political capital getting your politicians to say, yes, they want to increase their taxes. Operationally becomes really, really hard to effect. And therefore, don't be surprised. I was looking at these numbers for Kenya, and I apologize. Hopefully, it's not ChatGPT that's hallucinating, right? It suggests that Kenya should be able to raise about $100 million if it just doubled how much gets to the 70% retail cost, which is what WHO typically recommends for tobacco products, right? That's $100 million. That's $200 million. Currently, it's supposed to be collecting about $100 million on what is existing now. I took a quick look from what was disclosed as what came from excise taxes from the tobacco world. It was a tenth of that, right? It was 10%. Now, I'm not saying the tobacco shady, they could be, right? I'm not saying that the Kenya government doesn't know how to figure out what taxes are coming from where, but it's a much grayer zone to understand what monies are being paid by whom and where do they go and how do we capture them for health. That you have to think about those three domains critically and mobilize the right kind of partnerships and technical capability to get there.
I think I'll add one more domain. I think the reality on the ground, Edwin, as you mentioned, is that the technical solve is subordinate to the political issues and context. So if we don't get the politics right, you can have the most brilliant ideas that go nowhere in a country. We are thinking about, we went into a certain country in Africa and we're talking about...
Uranium.
Yes, shall remain nameless. The sugar tax. Guessing game. And
color on the flag.
Right.
Color
Green. That's like half the countries on the continent. And we were thinking about a sugar tax. And everyone goes, oh, sugar. Because there's a powerful sugar company that gives money to every single government. So when you come with your technical design and I see how much you can get, and you then incorporate that sugar company in that country, you're dead on arrival. So that's number one. The politics matters. And as technocrats, sometimes the politics is an afterthought. That idea. As advocates, we know the politics is number one. But we need to have that technical sort of hip pocket idea that we can propose. The second is the people. So taxes is about trust. And citizens don't trust their governments if they're going to use their taxes well, most citizens. So except you solve that trust deficit. Again, you're raising money for this, but how is it being applied? How is it changing my life? So there has to be an over-indexing in investment in sensitization to the people, ensuring that they can actually see, because this tax went up, the school fees were free, or the uniform became free, but linked it to something that affects my life. So now the people become your assets, because maybe the government can't go after the sugar guys because, but if the people start just clamoring, just too much noise from the people, all of a sudden my hands are tied. We got to do this thing. Yeah.
And we want to win the election.
So, and let's just, quiet the people for now. We'll figure it. But you have some space to implement something. So don't forget the people. We're working with another country and they said, and I was checking with them, so how is this product going? And they're like, you know what, it's in between the Ministry of Finance, Ministry of Health.
Many.
And she said, I wish that it wasn't just you asking how it's going. I wish the people knew so they can pepper the government to say, hey, how is this going? People are your assets. But I think sometimes the relationship between governments and the people can be interesting. So it's us as advocates to go in and foment a more productive conversation relationship. But don't forget the politics is my takeaway, and don't forget the people.
What do you do with big industries like alcohol, like sugar, when you're impacting their livelihood? Tobacco. What do you do with them? No one's going to say, sure, tax us, here's more of our profits. Like, how do you have that conversation? Do they even have to be in the conversation?
So they shouldn't be in the conversation. And part of what we need to do is protect the policy-making process, from that conflict of interest. But I think, following up on what Serah said around people and bringing in the public and having dialogue with public. It's so important because when you actually ask people whether they are supportive of these measures, they are overwhelmingly supportive of them, overwhelmingly, 80%. And I think we don't, ask, what people think. And as Serah mentioned, we don't now share, what's been done or what could be done. So if you read our summer reading, you'll see that, countries were successful when they linked it to universal healthcare coverage or family planning, like in Guatemala, or even in Philadelphia, free pre-kindergarten. And so, but that has to be shared, with the public. I would say around the industry countering perspective, because, one of the key things that I think they are very good at is making sure that they are getting their messages across, not just to policymakers in the corridors of government, but also to the public, whether through upfront advertising or subliminal, kind of advertising. And sharing misinformation and disinformation. But what we've seen is part of why they're countering is because this stuff works. Adam talked about what happened in South Africa. Consumption reduced 30%. Mexico, similarly, we saw drops in consumption. But industry is a market, and market follows demand. And so when you are able to change public behavior because of that awareness building that you're doing, and you're sharing information about what is healthy and what will support, families growing and growing well, people change their behavior and they ask for healthier products. And what does industry do? They make healthier products to meet that demand, And so, this can be a virtuous cycle. We need to, I always say, we need to make sure that we are creating markets for health, and making sure that we are increasing the demand, for healthier products. And so it's almost a twofer in the work that can be done around advocacy for taxes, that can also be done that supports cultural norm change and changes, kind of habits and creates new normals for how people are living through their lives, what they see on supermarket shelves, how they are walking to school, what fan ice is in front of school gates, and what children have access to in school.
And I think that the fiscal space that we're in is actually creating some momentum. So 25 countries, are paying more to service their debt in Africa than health and education combined, right? So for governments, there's a clamoring for where are we going to get money from? So in Senegal, for example, Senegal just came out that they have about 118% debt to GDP ratio, meaning everything they get from their GDP, they need to get 18 more percent. And this is counting, they're still ongoing. They've just raised their tobacco tax. They're going through the process right now from 75% to 100%, because government is looking for money. So now they're on a lifeline. Yeah, it's a burning platform. And so as advocates, we realize that there is a burning platform. Governments are looking for money, and if you have an idea for where money can come from, then they can decide and tell whomever to say, hey, it's either this or we don't pay salaries. Like, are you part of this country? Do you want this country to thrive? So these kinds of momentum moments can help us make the arguments more crisper to governments on why they should engage industry, one industry or the other.
Because sorry, Edwin, it's not a zero-sum game. Yeah, we're actually coming and we're sharing a solution around how to increase the pie. And so that is a very powerful argument. We're not taking from you, we're increasing the pie. Your slice can also potentially be bigger.
Right, collectively, you've made a really good case for why health taxes are important, why they should be imposed, why we don't have them yet. Now I want you to focus on how do we put health taxes in place. There's a political element, there's a social society element, there's a technical element. Edwin, be kind to us with the technical element.
You almost lost me at ad valorem.
ChatGPT was like, ad valorem, dude. Throw it in there.
We want it to be accessible because we also have to share this information with people who are not technocrats.
Yes. Yeah, so ad valorem is just add to the value of, right? just building off what Serah was saying, we have a unique opportunity now where countries are hungry for resources. They increasingly recognize a good chunk of that has to be domestic resources and are thinking that that is unlikely to change. And so they're asking, the health system we have built today, is it the one we should have? Or are there distortions that got created over the last 20 years through the fair bit of bilateral and multilateral money that was coming in? And probably more importantly, at least from my view, is governments had abrogated leading strategically on what's the health system they need to build, right? If you worked in a Ministry of Health, most of the time was spent in understanding, negotiating with the multilateral, the bilaterals, so you could unlock the resources, not necessarily saying, but are these resources enabling me to build the health system that actually my people need, right? And that is beginning to shift and shift rapidly, which then means that there's a really unique window to say to them, here are the things that matter. This is the kind of health system that you need to build for the future. Here are the things that are drivers of unhealthiness in your populations, and therefore these are the things that you can do. And taxation becomes one of those important ones because it has that dual effect of raising resources as well as dampening down demand. Now you have to think, is this, if you think of your classic Laffer curve, at what point is, do you aggregate as much taxes as you'll ever get? Do you then put that into a sinking fund, or do you spend it all once because you're trying to make a big push? Again, those are the technical kind of solutions that are needed. But countries are hungry now and they're willing to push back. But you have to understand that pushback is not in a vacuum. So I'll give a quick example, right? In South Africa, their wine industry is decently well renowned, right? Their wine industry contributes to GDP and employs directly about 90,000 people and indirectly about quarter of a million people, 250,000 people, right? Those are big numbers. And so if you're telling a government that the actions you take now are likely to reduce any of those numbers, then please have an answer to that conversation, right? Don't just assume, I told you increase taxes, all will be well, because I guarantee you, the minute you walk out of that room, industry will be in saying, dude, 1% of GDP, this is the amount of foreign exchange that we bring into the country when we sell our wine externally, and these are jobs for 250,000 people. What you gonna pick? And politicians mean well, but it's really hard for them to think long term.
Can you say that again, please?
Generally
I thought I misheard something.
I know.
I thought I heard you say.
I have struggled with this for many, many years. Generally, they mean well. Generally, not all. Generally, they mean well. Sure. What we are bad at is understanding what are the pressures, what's the game they're playing, right? They're playing chess, not checkers. We walk in playing checkers, being like, oh, just move this here, one thing, solve the problem. They're having to do 3D chess.
So Edwin,
political
let me be very direct.
So let's make
How
it
do
easier.
you get a health tax implemented?
Yeah.
That's what I'm curious about.
So in some ways, the good thing is most countries have a health tax, right?
90% of countries in Africa have
a health tax.
Right.
Exactly. So it's now increasing
More.
it to, so it's now increasing it.
Yeah.
Right? And because you have had a health tax, countries are actually sitting with data that says, what does this mean for the industry, the jobs, the revenue that gets generated, all of these things that industry walks in with, it is going to destroy the country. Countries actually have that information, but they just don't use it to push back, or they haven't done the analysis on it, right?
Yeah. And I think two things. One is the design. That's one of the reasons why I really appreciate working with Vital Strategies, because we can go into a country and say they want to increase sort of their health tax or their, sugar tax. But we know that if they don't design it properly, I think 48 countries on the continent have a permutation of sugar, tobacco, or alcohol. But if you don't design it properly, you've just gone through all this heartburn, and you don't have enough at the end of the day. So
and you don't have the proof back to the people
That you have
exactly. So Vital Strategy comes and say, okay, let's look at the context of this country. How do we design it properly? And there is something around the simple design, because it just helps with the transparency. Another country we went to, we said, okay, you have an excise tax for sugar. How much have you received for help? And then everyone's like, actually,
We don't know. Yeah.
which is a tragedy, right? Because you've gone through all this work of going to the ports. If you have sugar is this much, we're going to tax you. But it's gone through the fiscal system, and you don't have anything to show for it for health. You don't have anything to show for your people that you actually all the sugar that you're not drinking anymore, because of that, a few potholes have been fixed, or, whatever the case is. So the design is important, but the transparency and the simplicity of the system, so that you can show for it, and the transparency to say, because we gave you pay for no Coca-Cola or whatever, sorry, Coca-Cola, here's what you have to show for it. That increases, it's like a virtual cycle that the next thing you want to tax, they're like, okay, well, they saw how it did and this, so that's okay.
So let me give a practical example. Again, to the point I made earlier, if the numbers from the Kenya Revenue Authority are correct, that the country only got about $9-10 million from tobacco, alcohol, and sugar taxes, no president will want to engage with it. That's too small a number to say it's worth the pain.
Billion?
Million. 9 million, not billion, yeah. Right, $9 million, right? And so they'll say, is this worth the pain, right? Is this worth a political pain to do it? And it could be that they have the wrong data, right? It could be that it's been misclassified, very possible, but they have information which we should help them say, here is the real yield you will get, and here is the kind of impact it will have on the other side. I'll add 2 quick numbers. In Kenya right now, out-of-pocket health expenditure is about 20-25%. In Nigeria, it's 74%, which means a typical Nigerian, for every dollar that's spent in the healthcare, is coming directly from their pocket, right? If you're then linking that by saying, guys, a good bunch of you don't even drink soda or smoke anyway, right? So it's a small, right? And that's the thing, like you gotta do market segmentation, right? Like who are the people who will be most affected? How loud will they get if you squeeze a bit harder? And if that number can be isolated and managed, then you can make the connection back and say, this is helping all Nigerians in a massive way.
Panel, just give me a beat, because I'm going to introduce our audience to Rachel. Hello, Rachel. Rachel is our microphone curator. Rachel will stand in the aisle. Rachel is getting the microphone, finding out how to turn it how to turn it on. She's going to walk down the aisle, and you will all turn around and see her and be thinking about what you would like to talk to our panel about in about 2 or 3 minutes' time. Marianne, sorry, I interrupted you.
No. This is such a great conversation. And part of what Edwin is talking to is the need for country-specific data. And if you look at the action guide, you'll see all sorts of resources around some of the analysis that countries did to counter this. So Brazil, and I know we have some folks from Brazil here, so it'd be great to hear your experience. Brazil was able to counter that GDP argument, by saying that this is the cost of alcohol to the GDP. And this is actually how much we're going to increase GDP by taxing alcohol. And if you have that data and you arm government with it, then, there's a counter. So I think, that country-specific data is critically important. I think the other thing that we found that is important is connecting the dots internally, coordination across the different ministries, because how people can divide and conquer, but if we make sure that everybody's hearing the same thing, has the same information, and actually is talking together so they know what they have been told or not been told by different people, you're able to actually, as you ask that question, how do you actually make sure that this gets enacted? And sometimes, everybody's in their silo, everybody's doing their day job, and sometimes it takes, extra effort, to support that coordination and communication across the ministries, but also across ministries with the public, as Serah was talking about, and related to this data point is being able to cut through all of the noise and confusion, from the public. I will say one of the things that I was surprised about, when Serah and I first started to have this conversation, is when I would bring up taxes with health, folks who I know are huge health advocates working with governments, really pushing on this. And I mentioned health taxes, and literally the response was, but it's too hard and they don't work. That was the response. And so part of why we've come up with these reports is, one, to say it does work. Two, we know how to do it. It's not too hard. And three, we know that it has results. And that we can learn from countries, that have been successful in doing this, and that you don't have to reinvent the wheel. How can we actually connect the dots across countries, so you don't have to duplicate, because the time is now, the urgency is now. If we don't seize this moment, I do believe we'll lose it, and so, again, really glad you're all here, because we need to get not just the word out, but the tools and the resources out, because where there is waiting periods is where other people can come in and start to kind of confuse the issue.
And don't forget internal advocacy, right? You mentioned that the way the taxes come through, it's usually the Ministry of Finance. And empathize with the Minister of Finance, who is sitting and trying to figure out, as you mentioned, where does money go? Saying it goes for health is not as easy an argument as you think it'll be, because then the agriculture person says it should go for agriculture, and the education says it should go for education. So that internal advocacy within a country between the Minister of Finance and the Minister of Health.
So you can have a health tax that doesn't go to health.
You can have taxes that don't go for health. You can have taxes for agriculture, whatever else.
In fact, most of them just go to the general budget.
Exactly, and you can parse it out any which way. Yeah. And if you get for health, the minister might say, well, usually get an allocation of X%. If you get additional, we'll remove X. It isn't help, right? Because it's additive. So what argument do you make to the Ministry of Finance for why health is the building blocks of the society at this time? So if you don't have that advocacy with the technical and the political, again, it's an uphill battle. So yes, it's a triple win, but there's some tools you must go into the rooms with.
Let me just open up the conversation into the room. If you have thoughts, feedback, experiences you'd like to share, questions, please raise your hand. Thank you.
As let me add, because I think this is also important. Not
just here. And your hand needs to go higher than your head.
For you to be seen.
Thank you. Very good. All right, please stand up.
Can I add one quick thing?
One quick thing that takes 20 seconds.
So the administrative structure, the financial management of taxes is also important to understand.
Beautifully done in 15 seconds. Good afternoon.
Hi, listen.
Welcome.
Hi, good afternoon. Vivian Hekwazi from Nigeria Health Watch. I want to make two quick points, kind of questions too. So the first one is, when we talk about advocates, who are the key people who need to be pushing for these health taxes? One body that seems to be silent often, and we notice in Nigeria, is the medical associations. If anybody should be pushing for this, it's them. Then the second is, from experience in the UK, what happened with industry industry being forced to put health taxes is the alternative, they brought out healthier drinks. So it doesn't necessarily mean you reduce consumption of the unhealthier, but it forces industry to come up with alternatives that are much healthier than the normal SSBs that we see. Thank you.
Agreed. What you call a thing matters. There are places that call them sin taxes. I was talking to a politician in a country unnamed, and they're saying actually they want to call it luxury taxes, right? So it's not putting off people, but still doing the same thing. So it does matter. The things we got to out for sure.
Right, please.
Yeah.
Good afternoon. Ferdinand from Cameroon. We're advocating on health taxes also in Cameroon, and we actually have a live experience. And I want to, just standing up to agree. I haven't read the report, but I'm agreeing 159% that what you're saying is correct. The Ministries of Health and the Ministries of Finance really need to be talking to each other. We've had a parliamentary session where parliamentarians are ready for the taxation, and now a parliamentarian is leading and taking our letters to the Ministry of Finance to schedule a meeting for the design of the tax. That's the kind of thing that is happening. We had a survey in the population where 49% of the population agreed they would support the tax. But when you ask if they will support the tax if the government allocates it to health, 94% said yes. So it's true, the people will really support when they understand this, and we need to be able to cause our governments to understand this as well, to really be educated. And the last thing for me is the high-level political decision makers truly matter. They are political, yes, but this thing doesn't need to end at the technical level with us, the advocates, and maybe those who understand at the level of the Ministry of Health. We need to really take it up to the political. Right now, there's elections in Cameroon in October, and that's one of the reasons why most of the aspects of the work we have done so far has not progressed till now. It's because of the elections. So we now are trying to make the case as advocates that during elections, people still die. During elections, NCDs still matter. And so they need to make it an election issue as well and make the case. So I just wanted to really confirm that, even though I've not read the guide, but this is true. Thank you.
That's it. Okay.
Can I? Okay, sorry. I have many things. Yeah. So, because we've been doing this across different dimensions, you have to think about the overturn window for policy change. When government is stable, then you want to engage very actively with the current leadership that's there. In the lead up to the election, you want to engage with the technocrats, because sometimes the politicians are the ones that stop the actual thing happening, but the permanent secretary understands why this is important and can get it done. Leading into the election, as much as possible, you want all the major political parties to make this a key thing they will do. And so you need to follow those windows of potential change and lean in aggressively, depending on where the country is in its election cycle. Engage now, if they're in power for a while, get the politicians to agree. Just before the elections, when they're out campaigning, dancing in the markets, engage with the civil servants, because sometimes they can actually get really cool things done, because nobody's home, nobody's watching. And as much as possible, then get into the manifestos of the respective parties. And then don't be surprised if on the other end, they're like, of course, this is the thing that we want to do.
One quick thing on the advocates. I mean, Vivian's question and Ferdinand, you mentioned it really well. There are two advocates that come to mind that are really critical. One is the insider within the Ministry of Health that understands this and can advocate for this. Because when surround sound advocates are not in the room and they're pushing the paper, if that person standing in front of the minister can't make the case, really, really hard. But Parliament is the other advocate that also needs to come alongside. The medical associations have been challenging, actually, even across countries to get in. So perhaps it's finding the one person within, but don't forget the Ministry of Health themselves and perhaps the Ministry of Finance themselves. So maybe there's a relationship there where we're courting and we're training so that they can sort of send the intel with each other, and the Parliament can be very powerful.
Yes, good afternoon.
Right. Good afternoon. My name is Al-Nur Sharif. I don't have a country to represent. I'm a global citizen. But I really appreciate everything that you're doing in Africa for the taxes. I was born in Congo, so I'm back, in this room just because one of the reasons. So the taxes on health, it's huge in north of the border. I don't know if you know. 45% of all taxes, are spent on healthcare system that's completely broken. So one recommendation I would have is also reinvent the healthcare system. That's very, very important, because if we continue to do the same thing, you're basically following a system that's broken. So I've been investing in the past 15 years of my life in thinking about what the new system would look like. And there's a couple of things, and one of them is preventive healthcare, focus on that one. And the second one is building a healthcare system that's founded on the 6th pillar of lifetime medicine. So spend all the taxes on that one and see the whole world change.
One of the things we're doing is not just taxes, but also efficiencies within the system. It's forcing governments right now to say, if another dollar or naira or CD doesn't come into the system, what do we have and how can we use it better? I think it gets back to how do we ensure that the system we have is actually fit for purpose so that we're not pouring good money after bad. So it's a really important point. And I know not everyone is doing a portfolio approach, but it's good to know who in the ecosystem is doing that so they can come alongside you to complement this work on increasing health.
And that's why, sorry, Boniface has a question, but that's why the moment is now, because not only are we talking about how to mobilize domestic resourcing, but I think Edwin mentioned we're also in a period where we're reimagining national health systems. So these two things are happening together, and we can actually redesign from the ground up. So, so many reasons why, if you guys are leaving this room, you have to be talking health taxes, health taxes, health taxes. Yeah.
And hi,
I'm Bintu Kamara from the Campaign for Tobacco for Kids. Everything that you've said is so right on point. I think when I look across this room, I'm reminded that as we leave this room, we live together as one. Because as we're talking about health taxes, tobacco control or tobacco cannot be talked about in isolation. We have come to a point in the world now where governments want help, but they want help as one. They don't have time to waste. They want to do it now. They want to do it fast, and they want to do it really well. So as a tobacco control advocate, as I come in front of a Minister of Finance or Health, I can't and I should not be talking just about tobacco control. He'll be looking at me like, stop wasting my time right now, right? What do you want? So coming together as one, as a coalition for health taxes are extremely important. So I want to put that point out there. The second thing I want to say, and I think, Edwin, you've shown us you are the expert in tax tobacco. I'm just like Marianne, it's way too complicated for me, but it's real. I do think that we need to build capacity. We are all talking in numbers and in formulas and in projections and everything. When you talk about educating the public in order to build public support, it's so important that they understand how it's going to impact them. The other audience that's really key to understand and to make and shake things are the youth. The youth conversation is all about everybody's talking about, but it's so true. They are the ones that need to understand the concept and that need to, just really push the envelope forward. I think they will make a difference. Parliamentarians and decision makers are definitely listening.
And we need to be better at speaking with young people. And we had a session with them too, talked about, coffee talks. And I think what they told us was, what's NCDs? What are you talking about? So we really need to use language that people understand. And not just, and we need to ask them what matters to them and how they are thinking about trade-offs. And I have two daughters, one's 16, one's 20. Sometimes they come back to me and say, Mommy, you guys messed up the world. I don't know what you want us to do about it now. And so, how literally, how do we, kind of get outside of that space? Yeah.
The phrase I have come to dislike in what was a traditional global development, capacity building, because it feels it's a thing done unto you. Like the phrase I use is unlock agency, right? Is have the governance that works for them.
We have 9 minutes together in this format, and then we get to network. So if you've got a question you've been burning to ask, with dimmed lights, now is the time to put your hand up. All right, yes sir, go ahead.
Yeah, my name is Boniface Mbudia from AMREF, and I just wanted to add, from the conversation that we need to improve the agency of the Ministry of Health to demand for the taxes once they are collected. Because in many of our countries, taxes are collected, but they never get to the Ministry of Health. And if they do, the Ministry of Health is not able to demonstrate back to the Ministry of Finance what difference it made. And so there's still a little bit of work to be done to the Ministries of Health to improve how they engage in the collected taxes, because the truth is, in the next few years, taxes will be the real deal.
Yeah.
They actually are the real deal.
Yeah.
Right.
And I would say again, why this is, a moment that we need to seize is because there is work happening in parallel to strengthen financial management in ministries, and to digitize financial flows. Blockchain is another word I use that I don't know what it means. But we can follow the money, and we can create transparency, and we can create accountability. So let's link this conversation to the people who are investing in better financial management and digitization of financial flows, within ministries, and make sure as they're designing those systems, they're actually thinking about the flows, from finance to health. But I would also say from the health system to people, because it's not just about money is going into Ministry of Health. Is it actually making a difference in your life? Are you getting those subsidized family planning products? Is your child getting vaccinated? Are you getting asked whether, you've been screened for breast cancer? So we need to understand that part of the equation as well.
And I'll add one more thing. It's the health ministry to people. but to the outcomes as well. Because I think if we link it to the what, financing is not enough. And yes, people should feel like their lives are improving. But when a country can say, we're now reducing this outcome by X%, there's a sense of pride, there's a political injection you add to the conversation that people are now listening, and you can carry this conversation a lot further. So I think the outcome linkages, it's good to target, what are we trying to do? Is it infant mortality we're trying to reduce, maternal mortality we're trying to reduce, life expectancy? Can we channel it sophisticatedly into that area so we can say in 2-3 years we did it?
Yeah. And I had a bit of a throwaway comment when Boniface spoke, right? Which is, Africans have been financing their healthcare, period, right? I'll put a couple of numbers. Kenya's health budget is about $1.52 billion a year, roughly. The amount of money that Kenya receives from remittances is about $4 billion a year. The amount of ODA that was coming to just sub-Saharan Africa only is about $4 million a year. So the bulk of the financing of our healthcare was our taxes and our pockets. And that's why, to me, bringing back the agency is so important, the strategic thinking is so important, that it is building what works for us. And so taxes are not an optional thing. They are and have been a major part of how we financed our health.
Edwin, take a pause for a moment. Panelists, take a pause for a moment. We're going to take a question here. Can I just see, can everyone put their hands up who's got a question? All right, excellent. These are the questions for the networking session. Wonderful. One-on-one, individual attention from whichever panelist you would like to chat with. Congratulations. And you, madam, have drawn the short straw. You have the microphone. You have to ask your question in front of everybody.
Okay.
Please go ahead.
Okay. Catherine with Vice Health Diplomacy Alliance. I go a little bit more on the devil's advocate, and I'm going to ask you more on the basic. How much does it cost to gather this evidence when you don't have systems that allow you to gather this evidence? And how does that work?
Yeah. The data. Yeah, no, I think, part of, again, why we're having this is, to the extent that we can share the data and the evidence that already exists, because it exists. I will say that, again, talking with Serah and Edwin, they had no idea what some of you who are sitting in the room, the data and evidence that you've produced, you were not aware of that, so I think one of the first things that we can think through is how do we make sure that we are sharing what we do have, and how do we make sure that we are leveraging institutions that are actually already collecting this data and analyzing this data. World Bank, for example, has a wealth of information and data that is being collected. So maybe the systems are not there at the country level, but many of the multilateral banks, do have this information. So that's how I would think about that.
So excuse me, Emily. Go ahead. Do 15 seconds.
It reminds me, the World Bank did a paper recently on how many people do not read all their publications, which was interesting.
No, it was the UN.
Was the UN?
The UN did a report on how many people do not read UN reports, and nobody read that report.
So we need a better average for Vital Strategies reports. Can we better that average?
Yeah. And if it's co-authored by Adam, it's a must summer read.
Yeah. So data exists. So data exists. Sometimes it sits on somebody's laptop, and you just need to know the right guy who has the data. KRA data, survey data you might need to do. But I'll actually put it to this group that sometimes we focus on chasing data that means absolutely nothing in changing the mind of a politician. The thing that matters, in my humble submission to this team, is trust. Do they know you? Do they trust that what you're telling them is correct? Whether you tell them the number is 5 or 10, 100 does not matter. The messenger matters even more. So we spend so much time in trying to build the perfect case for XY, and that's important, but it is highly insufficient to get it done. I will walk into rooms where I have high trust, and I'll convince them to do the thing you don't want to do, and have zero data. And we don't have to spend enough time finding the right messengers. The last man standing in the room when a policy decision is being made is the most powerful person, and if that's not you, then it's your competitor.
Did you say man or woman?
Man or woman.
Okay.
Person. Human.
One quick thing, I know we're shy on time, Femi. Femi is like, guys, collaboration. right? So you're going to countries want customized data, right? World Bank might have some. We're doing baseline. Where's all the money coming in for health? If we're going to this outcome, what's the moonshot? So there's the projection. But we're collaborating with others who do that in some parts, might do it for nutrition, looking for how to pull those people into the room. Vital strategies will come in so that we can get a better picture. So don't forget the partners around you that can help you with this data.
Panel, what I find encouraging is there is so much more conversation to be had about health taxes in Africa.
We never thought it was possible.
I didn't think it was possible. No, I knew it was possible. I knew what stellar panelists we had. So I knew it was possible. We are going to take this conversation into our reception, which is in this same space. So I know you've got more things that you want to talk to our panelists about, and you can do that anytime in the next 30 minutes. But what I want to ask you in a very simple form is, now what do? We have this information. We know it works, it's proven. It's free money if you can make the connections for the public and your politicians. Now what? Serah.
Now what? So 48 countries in Africa already do a combination of this. I think in this room are people working in different kinds of countries. The question is, what more can a country do while incorporating the political sensitivities of the time, incorporating and ensuring that we're speaking with our community so we enhance the trust of taxes? Because as Ferdinand from Cameroon said, actually in Africa, we find that when people understand why for the tax, they actually don't mind it. Somehow in the US, it's like, oh, everyone hates taxes, but I don't find that to be the case because I think there's a trust. So let's look at how much more can we add. What's the political appetite for it? What's the conversation we need to have with the people? And how can it change real lives of real people and real communities? And then we can get started with this.
Edwin, now what? What do we do?
Be the last person in the room when a policy decision is made. If it's not you, find the person. That's your angle. Everything else is good and additional.
Marianne.
So Edwin talked about, we're already paying the price. We're paying the price for healthcare. And I just want to remind all of us, we're not just paying the price in naira and shillings and rand and dollars. We're paying the price in lives. And we need to fix that price tag. It needs to go back to the manufacturers of the harmful commodities. It should not be on the backs of people and the citizens and our future.
My one sentence is, take the Vital Strategies Health Tax Action Guide with you and use it and read it. Thank you for being part of Vital Talks Live at UNGA. We appreciate you. Please enjoy our hospitality. But before you do that, thank our panel.